This was May of last year that Children's Hospital Colorado really got everybody's attention with the announcement that they believed there was a state of emergency for kids' mental health. Well, nearly a year later, they say things have not gotten better. In fact, it seems to be getting worse, with fewer places for families to turn for help. Anusha Roy looks at how we got here.
With COVID, it was obvious that more people would get sick, so our hospital started adding more beds. But when the same thing happened with kids and their mental health, the opposite happened. There were less beds and less resources for them. In the last 5 years, 16 of these facilities shut down in Colorado. Advocates say if you go back to 2007, that number triples, and COVID made everything worse. So how did Colorado get to a place with more sick kids and fewer places to help them? There was a shift in philosophy around 15 years ago that it would be better for kids to get behavioral health help in familiar settings, not a facility. So the state went from 1,600 kids in congregate care to 300 in 2022. But the kids who did need help needed more intense help. And then on top of that, there's a shortage of resources across the board. In Colorado, in particular, the system of care is fractured and more regional based. Investments needed 10 years ago didn't happen. And for some reason, mental health care and physical health care were considered separate, so behavioral health didn't get funded well. And with fewer places to turn to, kids are showing up in emergency rooms like at Children's Hospital Colorado, where at times half of their ER is filled with kids in a behavioral health crisis.
On top of that, some kids are staying in the hospital for 5 to 6 months because they just have nowhere else to go. 2 more facilities were just announcing that they're having issues scaling back with residential treatments or dealing with funding issues as well. And the state knows the system in Colorado is not working the way it is right now. So they're launching what they're calling a behavioral health administration in July to try to streamline the resources and the funding. They're also working to stand up new units as well, Kyle.
You'd think this is the last time that you'd want to see any kind of contraction in the system with places closing. The reason for that?
Right. So we talked to a whole bunch of different people today along with the state, and overall, some of the facilities over the years have had to close down because of safety concerns. And one of the experts was saying that, these facilities, sometimes there's inconsistent monitoring, so that there's another weakness in the system there. But in the last 5 years, the state was saying that there may have been less demand, and that's why a facility shut down. They were also subject to a lot of the same issues we're seeing in other industries. They're having issues hiring, staffing, and making the money work in these situations has been really difficult.
Appreciate your persistence on this topic that matters to a whole lot of people. Anusha, thank you.